Welcome to INOvators, a series where we sit down with thought leaders in the healthcare technology space to talk about the news and trends that are impacting our industry today. Joining me today is Dr. Paige Kilian, our Chief Medical Officer at Inovalon. This episode is part of a mini-series where we look specifically at 2026 and what our internal thought leaders predict will be top of mind in the healthcare tech space. Paige, thanks for being here today.
Happy to be here. Thank you for having me.
So to start off, what do you think are some of the biggest challenges from 2025 that we'll continue to face in 26, and how can the healthcare system better address them?
I think the biggest challenge in 25 comes down to uncertainty and upheaval. We've had an undermining of public confidence in evidence-based medicine, and I think that the healthcare industry has to focus on that reality. The healthcare has to be delivered with steady guidance, with a devotion to patient education, and with a commitment to ensuring that regardless of what's going on in the greater world, patients have access to evidence-based medicine.
So to improve patient care specifically, what are the key focus areas for providers and organizations like Inovalon who support them?
That is an easy one. We have to use AI to reduce administrative burden in the system, thereby increasing access to healthcare.
And what about other areas of healthcare? What are the focus areas for health plans, pharmacies, life sciences to improve how healthcare works overall?
You're not going to get me to change my answer. We all have to focus on reducing the administrative burden, the burden that is driving pharmacists and doctors and nurses out of healthcare. As an industry, we have to focus on using technology to reduce administrative burden and preserve and increase access to healthcare.
All right, last question. What projects or maybe new innovations are you the most excited for in 2026?
On our side, I am extremely excited about where we're using technology to reduce administrative burden, specifically in the prior authorization process, and looking forward to a concurrent coding capability. So using AI to ease the burden on the doctor's side, on the nurse's side, on the pharmacist's side, get the information where it needs to be without interfering with the doctors, the nurses, the pharmacist's interaction with the patient.
I love it. Very exciting stuff for sure, Paige, and it certainly will be interesting to see what is to come in 2026. Thank you so much for being here and for sharing your insight.
Thank you so much for having me. Let's change the world.
And to our audience, thank you guys so much for tuning in. Be sure to check out our other episodes of our Trends and Predictions miniseries.